Hello, I'm Mary Coleman. I'm the RN-BSN coordinator at Appalachian State in Boone, North Carolina, and I have a brief presentation this morning on our program. So I'm going to share my screen so you all can see it. Okay, so we are a part of the Beaver College of Health Sciences, which we'll talk more about in a moment. So you're here, you're thinking about a bachelor's degree. What we want to do is take your existing knowledge and experience. So you may be a new graduate nurse, bringing forward some experience from your associate's degree, your diploma program. You may have had years and years of experience. We've got students all across that spectrum. And we want to use that to enhance your care of patients and families. So we want to start thinking about quality improvement things or safety issues. We also have found that nurses with a BSN report being significantly better prepared in areas that are related to quality and safety. And I think some of that's based on their coursework. And in a study found also that a 10% increase in BSN prepared nurses on unit decreases patient mortality by about 10%. So other things that people may think about, there's lots more job opportunities as far as maybe you want to move into a leadership role, maybe you want to go into education, lots of different, maybe you want to go on to a graduate school, so lots of different options. When you're thinking about a BSN at App, we've got, our primary program is a 12-month program designed for working professionals. So it's designed for people who are working either shifts at the hospital, maybe your day shift, maybe your night shift, maybe they work swing shifts, or maybe you work Monday through Friday at a clinic. Lots of different people do different types of work in our program because it's all online and it's asynchronous. So there's not a required time for you to be logged in. It's very affordable. And we have really experienced faculty. So that's a good thing to look at when you're comparing programs, is to see how many of the faculty are full-time faculty, how many are adjuncts, and the vast majority in our RN-BSN program are full-time faculty. So they're engaged in university, they're engaged in curriculum planning and research, lots of different things. We also have excellent student support options. So we have a writing center, we have nursing specific advising, and you've got my role too as the coordinator. So one of the things that I do is if students are, COVID was a great example, right before Thanksgiving or right after Thanksgiving, lots of students came back and there were several that had COVID, and that's kind of a busy time of year in school, right? It's right before winter break where you have finals and lots of things in your different classes. So I was able to help the students work together with their instructors, and we came up with a plan to help them be successful, help them get better, help them be successful in the rest of the semester and make sure they were able to progress. So we're a part of the Beaver College of Health Sciences, which was founded in July of 2010. And we are a part of 6 different academic departments within the Beaver College. So communication sciences, health and exercise science, nursing, nutrition, healthcare management, rec management, and PE, and social work. So we also have a PA joint venture with Wake Forest, and you'll see lots of different interdisciplinary work going on within the department and within the college as a whole. Within our Department of Nursing, our RN-BSN completion program actually predates the Beaver College of Health Sciences. And so it began in 2006, initially as a program where people would commute to Boone, and now our RN-BSN program is completely online. We have a pre-licensure program as well. And we also have a Master's of Science in Nursing, specifically for people who want to be nurse educators program that began in fall 2016. We are approved by the Board of Nursing and by CCNE. So as far as admission criteria, you have to be admitted to the university and meet their criteria. And then after that, you have to have a completed associate's degree or diploma, a current nursing license in North Carolina or a compact state. So this is really important. It has to be somewhere that is either North Carolina specifically or one of the states we have a compact, and they're in the compact. a cumulative GPA of 2.5, completed all your required prerequisites. So we don't have room in our curriculum to do prerequisites to go. So all of the prerequisites have to be finished before you get here, and health records and immunizations. We do have a great option for some students. So we admit each year in the fall, which we'll talk more about. We have a cohort that starts each fall. Let's say you are about to graduate with your associate's degree, and you know that you're going to graduate in May with your associate's degree, and you'd like to start with us in the fall. In that spring semester, you are able to apply, even though you haven't finished your ADN, you haven't finished your nursing license. You don't have that yet. You can apply and get conditional admission, which means if you're successful and you complete those things, it really saves your spot. So you can go ahead and get admitted, have a plan to keep coming. You don't have to wait until you've finished all of this. The same goes for prerequisites. Let's say it's the beginning of the spring semester and you're going to finish a statistics course, or you've got a class or two to finish up. You can apply if you have a plan to get those finished over the spring and the summer semesters, and then start with us in the fall. Other things that we've got our transfer admissions team, which helps with transcript evaluation. All of the courses in the RN-BSN program must be taken at App. So if you have classes in another RN-BSN program, they probably won't transfer because of the number of classes you have to take at the university. We've got an articulation agreement with the North Carolina community colleges as to what we will accept from the prerequisite and work through those. And after successful completion of nursing 3011, which is our concepts of professional nursing class, you get 30 credit hours for previous learning and clinical competencies. So so you take 30 hours in the RN-BSN program, 30 hours for previous learning and clinical competencies, and then 60 hours from your prerequisites all come together to make the 120-hour package at Appalachian. The requirements vary based on background. If you have a previous bachelor's, requirements look a little bit different. So I've put the transfer admissions email up here. Also, if you look at our website, you can see they've got a great self-evaluation on there too that can help kind of guide you looking at your transcripts. So we're happy to help look at what classes you need and make sure that everybody's on the same page. Admission information. So we do rolling admissions. What that means is we will review all the way through. We have priority admission by February 1st. So we'd really like you to apply by then, but admissions for the fall are taken until early August. About 150 nurses are enrolled each year. And there's a link here for the application. You can find the application, how to apply at online.appstate.edu, and then you navigate to the RN-BSN program from there. So we've got 3 different options of how you can progress through the program. We've got our 1-year program, and then 2- and 3-year. I'm going to go through all the classes and then I'll show you how they kind of break down. So in the fall, we offer health assessment, which is where, we know you're assessing patients already, but we take that information and we start to look at how do we use our assessment data and what we're learning about our patients to help motivate them to make better health choices. How do we communicate our findings to providers in an effective way? What are some, a lot of times in the health assessment classes early in a program, you're looking at more what's normal. We start to look at more of those abnormals, talking with patients and families and doing an assessment. You'll actually do a head-to-toe assessment on a client during this class. Nursing informatics is looking at your electronic health record. It's learning how to use Excel and PowerPoint effectively to present or put together budgets, things like that. Concepts of professional nursing is a course where we start to look at what does it look like to be a bachelor's prepared nurse. So you'll work on your personal philosophy of nursing. We'll look at some nursing theory. There's an op-ed paper where you put out some of your information that you've reviewed and you've learned. There's also, we have in the spring nursing care of communities, which is what it sounds. The community is your patient in this class, and you do your assessment typically in the county where you live. And so you'll drive around your county and do a windshield survey. You'll talk to a key informant there. Lots of different things come together so that you can make a great plan on how to improve the health of your specific county where you live. So we also have nursing leadership and management. So learning about leadership styles, learning how to manage different types of staff or budgets, or how different things work at the hospital. Nursing research is really getting more into evidence-based practice, how to be a good consumer of it, how to evaluate research, how to report findings, those kind of things. Nursing care of older adults is what it sounds like, and professional nursing synthesis is a great class where it really puts together everything you've learned the whole course. So we, or through the whole program. So what we do is you'll do an evidence-based practice project. So you will take a problem. After doing an assessment, you'll take a problem in your workplace, or if you're not working, you'll have a clinical site where you'll talk to a manager, talk to peers, and figure out something that you want to work on, that you think needs changing. People have done everything from doing a flu clinic during COVID, to making a unit a locked unit, to making a float pool. Lots of different options based on where you're working and what they need. Some people have done translated information for patient education on iPads that is more available. So lots of different neat things. And a lot of people go on to use that for clinical ladder and that kind of thing as well. So if you look at this, we've got a 2-year and a 3-year plan from here. You'll notice it's the same classes and the same semesters, it's just slowed down. So instead of taking 3 classes and 3 classes, you'll see that you start out with 2, and then you progress. And then in the 3-year plan, it's really if you're at that point where you want to take 1 class a semester as we go through to, and you will be in the program for 3 years. So several different options based on what you need and what works best for you and your family. Additional program information. As far as clinical sites, it looks much different than long days at the hospital with an instructor checking you off. Our clinicals are non-traditional and asynchronous. So it may be class projects, it may be research, it may be a head-to-toe video that you record and you submit with a nurse mentor evaluating you, a community assessment, lots of different, an interview with someone, lots of different things that you may do, but you will not have to be at a certain site at a specific time for clinical. Other fees, lab fees. Students also have to have liability insurance, which is a part of our program fees, as are the lab fees. And then we also have a clinical requirements tracking system, which is about $150 a year for students, which helps go through a lot of the requirements that I'm going to talk about. It helps us track those and make sure everybody's compliant. Textbooks are included in tuition, which is great. It's about 40 to 60% less than buying hard copy textbooks. You don't have to worry about your syllabus when things are coming in the mail, that kind of thing. So we have, on the first day of class, you'll go into your course and there's a button that says My Materials, and your textbook will be right there in an ebook version waiting for you. If you don't like that, we've got an option to opt out of it and you can order your own textbooks. But it's really nice that it's available like that for students. Requirements, a criminal background check and drug screen are completed that first semester. And we also offer, or we also require basic life support for healthcare providers offered by the AHA. We will sometimes accept American Red Cross depending on the circumstances of your employer. Immunizations and PPD testing as well. So all of these requirements go into our clinical tracking system that you will have to complete when you're in that first semester of the program to make sure you get everything in and compliant and ready to go through the program. So even though our clinicals are asynchronous and non-traditional, we still have to make sure that you meet all the facility requirements and basic safety requirements. So that's why you still have to turn in immunizations and all that kind of stuff. So we do require those. Information about our department. So I'm the RN-BSN coordinator. My contact information is here. We do have a director of academic support and program compliance, Dr. Turpin. She really monitors all the requirements that we talked about just a minute ago, and then she also makes sure that the program's going smoothly for you. Dr. Raymond is our department chair. Dr. Bernard is our undergraduate program director. Dr. Raymond and Dr. Bernard both teach in the RN-BSN program, which is great because it really gives, they have a great pulse on what's going on in the program, what our program needs, and that kind of thing. So if you've got questions, where do they go? So if you've got questions about admission to the university, what classes are going to transfer, this transfer admissions at appstate.edu or speaking to your transfer counselor if you've already talked to somebody is the best way to go. Once you're registered and you're in the program and you've got questions about registering for classes, that kind of thing, we've got support for that as well with our online team. And then if you've got questions about curriculum, other questions, or if you can't remember who you're supposed to ask, please feel free to email me. My email is here as well. Let us know if you need anything. We're excited that you're interested in Appalachian. Thanks so much.